Hello, so today we'll be talking about an issue affecting the gym setting. So we'll be talking about the lack of knowledge from personal trainers. The requirements needed to be a certified coach in the UK at the national level include a level 2 gym instructor qualification, a level 3 personal trainer qualification, a first aid certificate, and a personal trainer insurance. To answer that question is not always the case. So we'll be using data from statica.com to analyze that. So here we can see the total number of people with sports and fitness occupation in the UK from 2011 to 2017. And the statistic presents the total number of employed and self-employed people with sports and fitness occupation in the UK. So as we can see here, in 2011 we had 131,000 people in the fitness and sports section, and in 2017 it increased to 188,000. We can definitely see an increase into interest into sport and fitness. However, this does not guarantee that the coaches are certified. So according to personal trainer London, there are different providers for getting personal trainer qualifications, and those include Careers in Fitness, Discovery Learning, Number One Fitness, Origin, DYMCA Fit. Even if the coaches are certified, this is not a guarantee of knowledge, skills, and competence. For example, Crawford et al. 2012 showed that high expectations can be detrimental for weight loss programs. The lack of knowledge can also cause overtraining. There is a research by Cristian et al. 2013 that showed that when overtraining is occurring, the client can feel irritable, fatigued, and anxious. And eventually, the client will lose their sense of humor and enthusiasm for the workouts. The reason for that is that once the personal trainers get their qualifications, they don't do continuous learning, trying to learn new knowledge, or attend conferences, and also they lack academic readings. So now let's talk about the research. So in 2002, research by Malek et al. 2002 showed the importance of health science education for personal trainers. So the findings showed that a degree was more likely to be a predictor of a personal trainer knowledge, whereas certificates and years of experience were not. And the degree included sports and exercise science, American College of Sports Medicine, or the National Strength and Conditioning. And the conclusion was that personal trainers should have licensing requirements such as a bachelor's degree in exercise science and certification by an organization whose criteria are extensive and widely accepted before being allowed to practice in their craft. So Glenys et al. 2005 showed that in some cases fitness instructors were not prepared for dealing with overweight or obese clients. And the conclusion was that there is a need for a system of accreditation for fitness instructors, and that provide the public with some measure of quality assurance. Also, how about the people with disabilities? So, James 2005 showed that people with disabilities remain one of the most physically inactive groups in society. They participate less in a regular or vigorous physical activity. So as a consequence, they are more likely to be fatigued, they have weight gain, and they are in pain. And this raises serious concern towards their health and well-being. So we need more and more personal trainers to be able to deal with that kind of population. Xiaofen et al. 2009 showed that there is a deficiency in fitness education. In addition, little is understood about how health-related fitness knowledge contributes to the establishment of a lifetime physical activity pattern. Stacey et al. 2010. So this is a systematic review. So the findings showed that little is known about how fitness trainers obtain and incorporate new evidence-based knowledge into their practice. So we will look at the personal trainer competency needs analysis. We have a paper from Wen-Yu-Chiu et al. 2011. So the findings show that a trainer needs, in theory and application, course design, management and marketing, and facility, safety, maintenance and healthcare. And this is important for trainers to raise their professionalism and competitiveness. Personal trainers should be constantly trained and accredited by international certification institutions. With a reference to the result of this research, a personal trainer education or certification institution may develop their future programs or establish better evaluation criteria. So after going through all the research, we can clearly see that there is a need of a higher, more integrated and comprehensive skill set to become an effective personal trainer. Modules like anatomy, biomechanics, psychology and physiology are becoming more increasingly important. So there are other modules such as quantitative research method, biomechanics and performance analysis, applied sport science, qualitative research, investigating sports and exercise, quantitative data analysis, health and well-being, exploring practical sport and exercise, and the participation in sport and physical activity, human movement, etc. All those modules are becoming important to understand the clients that we are working with and to promote participation as well, health and well-being. So in conclusion, sports and exercise science or bachelor degrees are new and well adapted to enhance the skills of the fitness trainers in the UK at the national level. The industry is growing and getting more professional, hence the development of new academic programs to support the industry needs. My experience in the gym where I worked, the personal trainer was qualified and knowledgeable. The personal trainer's knowledge wasn't anecdotal, and he was often updated with research and also attending conferences and clinics. If you have reached this far of this video, thank you for listening. Have a nice day, and it was a pleasure to discuss about this topic.